What if I told you there's a virus out there that's been quietly spreading, affecting people of all ages and causing serious respiratory issues? You've probably never heard of it, but the truth is, it could be in your community right now. I'm talking about HMPV, the human metapneumovirus. It's a virus that's been making headlines recently, and in this video I'll explain exactly what it is, how it spreads, and why you should be concerned. Stay tuned because this virus is something everyone needs to know about. Let's start with the basics. Human metapneumovirus, or HMPV for short, is a respiratory virus that was first discovered back in 2001. It primarily affects the lungs and airways, causing symptoms that are similar to the flu or common cold. HMPV is part of a family of viruses called Paramyxoviridae, which also includes viruses like the measles and mumps. But here's the kicker, HMPV doesn't just affect children, it can affect anyone, from infants to the elderly. And in some cases it can cause severe illness, especially in those with weakened immune systems. You're probably wondering, how does it spread? HMPV spreads just like many other respiratory viruses, through droplets when an infected person coughs or sneezes. You can also get it by touching surfaces that have the virus on them, and then touching your face. This means that during flu season or in crowded areas like schools, public transportation, or hospitals, it's easy for this virus to spread quickly. So what exactly happens if you catch HMPV? The symptoms can vary from mild to severe, and they often mimic other viral infections. Common symptoms include coughing, runny nose, sore throat, fever, and shortness of breath. In more severe cases, HMPV can lead to pneumonia or bronchitis, especially in young children, older adults, or those with underlying health conditions. Yes, HMPV is highly contagious. It spreads through the air but also through surfaces like doorknobs, handrails, and even phones. It's important to wash your hands regularly and avoid close contact with infected individuals to protect yourself. And just like with the flu, the virus can linger in the air for hours, especially in enclosed spaces. That's why it's crucial to stay vigilant during peak seasons for respiratory illnesses. Here's where it gets real. While most people recover from HMPV within a week or two, there are risks that shouldn't be ignored. The virus can lead to severe complications, especially for the elderly, infants, or those with chronic illnesses like asthma or heart disease. In fact, hospitalization rates for HMPV have been rising, and in some cases the virus has led to death. So, it's not just another cold, it's something you need to take seriously. So how do you protect yourself? While there is no specific vaccine for HMPV yet, there are several precautions you can take to reduce your risk of infection. 1. Wash your hands regularly with soap and water, especially after touching surfaces in public places. 2. Avoid close contact with people who are sick. 3. Cover your mouth and nose when coughing or sneezing. 4. Disinfect frequently touched surfaces like doorknobs, phones, and remote controls. And 5. Stay home if you're feeling sick to prevent spreading the virus to others. If you think you or someone in your family has HMPV, it's important to watch for signs that the virus is getting worse. If you experience any of the following, you should seek medical help immediately. Difficulty breathing, high fever that doesn't go away, severe chest pain or pressure, worsening cough or shortness of breath. Don't wait too long to get help, especially if the person affected is very young, elderly, or has a weakened immune system. Now, if you're diagnosed with HMPV, there's no specific antiviral treatment for the virus. But don't panic. Doctors can treat the symptoms with things like pain relievers for fever and aches, cough medicine to reduce symptoms, oxygen therapy or ventilators for severe cases. In most cases, rest, hydration, and symptom management are enough to recover. But if you're at high risk of complications, your doctor might monitor you more closely. HMPV might not be as widely known as some other respiratory viruses, but it's just as dangerous. And with the ability to spread quickly, it's something that all of us should take seriously. By understanding how it spreads, recognizing the symptoms, and taking simple precautions, we can help protect ourselves and others from this potentially harmful virus. If you found this video helpful, make sure to like, subscribe, and hit the bell icon for more health-related content. Drop a comment below if you have any questions or if you've had personal experiences with respiratory viruses. We'd love to hear from you. Stay safe, stay informed, and take care of your health. Until next time. Thanks for watching. If you think this video could help someone else, share it with them. Awareness is key in preventing the spread of diseases like HMPV,